Hello, medical students. My name is Dr. Nina Vasavada. I'm a nephrologist here in the Division of Nephrology at University of Louisville. Here to talk to you about nephrology as a specialty and field of study, talk to you about why I chose nephrology, what the training is like, and what a typical work week is like. Here are a couple of what I think are very important, helpful books in nephrology. These are the older versions. This is Brenner and Rector's The Kidney, Clinical Physiology of Acid Base and Electrolyte Disorders by Burton Rose, the editor Burton Rose, and Handbook of Dialysis. All three of those have been important books for us to refer to over our careers. So first I'd like to talk about what drew me to nephrology. When I was a medical student and resident in internal medicine, I had some fantastic cases. One stuck out in my mind was a young, active, functional, professional young gentleman who came into the hospital with a life-threatening arrhythmia, life-threatening acidosis. His potassium was 1.3. He was admitted to the intensive care unit and he was globally weak. And it turned out he was a carpenter who was abusing the inhalation of paint solvents and glue to get high. So those chemicals, those paint solvents and glues contain a chemical called toluene, which causes a distal renal tubular acidosis and hypokalemia that goes along with that. I thought it was fantastic to watch the renal team figure it out, give this young person a diagnosis that he could work with, and give them a treatment plan to really improve this person's quality of life. So the physiology drew me into the field. As I have practiced nephrology, the patients and the humanity of it all have really kept me engaged. So nephrology is a field where you see a wide scope of patient demographics. You're going to see patients who are older teenagers, young adults, pregnant women, postpartum women, middle-aged patients, elderly, and the very elderly. And I find that very satisfying to see a wide range of different age of patient. It is also a field where you see a lot of chronic diseases that affect different races differently. It gives you a daily opportunity to work on healthcare disparities, and I find that very satisfying. The next question we want to talk about is, what is the training like? So training for a nephrologist involves 3 years of internal medicine residency, followed by either 2 or 3 years of a nephrology fellowship. So that fellowship can have a couple of different components to it. Within basic nephrology fellowship, you're learning the scope of kidney disease care, which includes kidney disease, primary and secondary, and then hypertension, transplant nephrology, procedures including dialysis catheter placement, kidney biopsies, and at certain centers you learn interventional nephrology, which is placement of tunnel dialysis catheters, as well as doing fistulograms and angioplasty for malfunctioning vascular access used for hemodialysis. So that's the scope of the nephrology fellowship itself. After a nephrology fellowship, there are opportunities to do further study in interventional. There are opportunities to do further studies in transplant nephrology, and the transplant nephrology is a 1-year fellowship that you would do after your general nephrology fellowship training. A typical work week for a nephrologist involves 3 different venues. We cover outpatient clinics, outpatient dialysis centers, and inpatient hospital consult services. So outpatient clinics are generally where you see chronic kidney disease, referrals for proteinuria, hematuria, any other urinary abnormalities, kidney stones, resistant hypertension. That makes up the bulk of outpatient nephrology. Here at University of Louisville, we also have some subspecialty outpatient nephrology clinics. So we have a clinic for metabolic bone disease, a clinic for kidney stones, clinic for resistant hypertension, and then we have the whole program for transplant nephrology, including clinics for outpatient transplant follow-up and pre-transplant workups. We also, as an outpatient, see home hemodialysis patients. So these are patients who are doing either home hemodialysis or home peritoneal dialysis. They do the procedures at home and then they come into the office once every month for evaluation and management. The other venue where we see patients is outpatient dialysis centers. So these are patients who are on hemodialysis. They come to those centers 3 times a week. They stay about 4 hours each time they're there. And so generally about once a week a provider is seeing them along with the dialysis staff who are there staying at the dialysis unit and operating the unit on a daily basis. The final place where nephrologists see patients is the hospital service. This